All right, here we go. So the topic for today is what is the actual process for getting an IEP? So starting off, there are a couple of different ways that you can process to get your IEP for your child. The first process is through early intervention. So for any kid who is about to age out of EI, the discharge process should include a transition meeting with the public schools. That way you're starting off with an IEP, you're getting the final evaluations, getting goals and things set so that your child can transition into the public schools, or at the very least, just to hear what could be offered for your child after they have aged out of early intervention. The service coordinator should be providing a written referral of a potential eligibility for your child to the local education agency, and this is what gets the process started. It should occur between 9 months to 90 days before your child's third birthday. So prior to them aging out of EI, this process needs to get started by that service coordinator. If your service coordinator is not doing this and your child is of age or within that time frame, you need to have yourself reach out to your service coordinator and just ask about it. See what's happening, see if that's going to be part of the process because you haven't heard anything, so that you can request that that be done. This is different than the actual discharge meeting. And it's important that we start to advocate for this to occur, even if a child is going to continue with clinical services here at CPTWC, because we want to make sure that the child is eligible for any services that they would receive at the public schools, as well as keep your options open as to what could be provided. It's a natural transition time, and it's much easier to get an IEP evaluation during this process of aging out of EI than it is when a child is transitioning to school. We can get the IEP as they're aging out of EI and then call for the meeting for it to be updated when they do transition to school. Another way is through early childhood. It's now universal. Any child is eligible. You do not have to be enrolled in early childhood services to receive speech services. There are programs that are speech-only programs that your child could be eligible for. There's also a program for preschool itinerants. So this is accessing early childhood special education teachers in the general ed setting for up to 120 minutes per week. And then there's a preschool inclusive or a blended classroom program that provides access to an early child program for the special ed teacher in that general ed classroom for up to 500 minutes per week. And then the last one is a preschool program with intensive support. So this is a special education classroom that provides preschool education to your child as an early childhood program. Not all of these programs and services are going to be available at your neighborhood schools. So CPS may have schools, your neighborhood schools may have different programs. They may offer preschool itinerant and preschool inclusive or a blended program, but maybe they don't have a preschool program with intensive support. So at that point in time, as part of the IEP process, they will talk to you about different schools that do offer the support that your child may need. So just note that the neighborhood school that your child may go to may not offer all of the supports and the preschool programs that your child may need in order to access those services, because we want to make sure that the child is provided with that free, appropriate education within that least restrictive environment. There's also the process of child find. So each state must have policies and procedures to ensure that all children with disabilities residing in the state are identified, located, and then thus evaluated. In CPS, they do early childhood developmental screenings for children between the ages of 0 to 5 years old. This is free of cost. This does not cost you any money at all. For example, your kids can go and do this screener at your local library, and CPS will provide this assessment. And this is part of Child Find. So the screeners are locating and identifying the kids that will need to be evaluated. So they don't actually go through the entire evaluation process. They're providing bits and pieces of a screener to assess whether or not a child has a disability or has a need for services that would need further evaluation. Once it's been deemed necessary as part of the screener that they've been identified and located as needing potential services, they will get redirected to the citywide assessment team for their evaluation. It's important to note that the screener does not guarantee that your child will have an IEP. that process will come out of the evaluation to determine those IEP services. The purpose of the Child Find screeners is just to locate and find and identify if a child has any needs that they would potentially need further evaluation to assess for services. There are also ongoing assessments of children within the general education classes to help also identify if a child needs further evaluation. You can also go through a process of self-referring. So you yourself as a parent or a guardian can request for an IEP. I cannot stress this enough, it must be written. Regardless of how many times you talk to the classroom teacher, you talk with the principal or a paraprofessional or even the director of special education, that's not going to be enough to make sure that your child is being referred for a potential evaluation for services. The school has 14 days once they receive your written request to approve or deny this request. And this can happen even before the child starts school. So if you're thinking of your child to be going into the school system this fall, this is something that we should be working together with to ensure that your child is being referred for an evaluation for services for the IEP. So you would need to contact the Office of Diverse Learners and Supports and Services to get the evaluation process started. Again, still has to be written. At the tail end of this, I'm going to show you 2 example letters that you can tailor to your needs to request not only an IEP, but the first step of the evaluation process. And then there's also teacher referrals. They can also request the child to receive an evaluation. So again, as children are within that general education classroom, the teacher will be doing their own assessments to determine progress and needs, as well as further modifications. And they would be able to identify whether a child needs to get further evaluation for IEP services. If this occurs, the service provider will complete the screener prior to meeting with the family to discuss that, hey, this teacher and the team has determined that your child has some concerns of educational abilities that we would like to further assess with an evaluation. This is probably the least common, but it does happen within the classroom for a teacher referral. So I'm going to go over and show you some timelines. I will also share this document with you guys, but I wanted to make sure that you have some ideas of timelines for the school or the Office of Support Services to respond to you. So for the initial evaluation, this is the first time that your child has ever been evaluated for services. Maybe that's through Child Find. They've done the screener and they've identified that your child needs to be evaluated, or you yourself have put in a self-referral. They have 14 school days to respond to you. So this also accounts for any holidays that may be happening. So in January, if you wrote one on, I think, 1/12, and there's a school holiday on the 19th, that school holiday would not be counted as a school day. It's when they're in service. So after you ask in writing, the school can also say no to the request in writing, but they also have to explain why they're not evaluating him or her. Or it would verbally say yes and get your signature within 14 school days to move forward. The next thing that you have to do is you have to provide consent for this evaluation. So even though you're requesting it and you're saying, yes, I want my child to be evaluated, they still need a written request consent stating that you are okay with evaluating them. So once they have that done, once they have your consent, they have 60 days, school days again, to complete their evaluation process and hold the evaluation meeting to debrief and talk about all of the evaluation results. And subsequently, the IEP is held at that same time. So once you say yes to testing, the school has 60 days to meet that testing requirement and have a meeting. If they can't meet that requirement by any point in time, they need to let you know. Like if they need to extend the time period, they have to let you know. If it has to be shorter, they need to let you know as well. This team must still agree or disagree as to the evaluation within that 14 days if they're going to meet or not meet that 60-day approval. And then written notice of eligibility. after 10 school days, after the eligibility meeting, the school will send you a letter saying if your child will get special education services or not. So they have to first have a meeting to determine eligibility of services, and then they give you 10 days to send you the letter stating yes or no. You can waive your right to the written notice of 10 days. Usually at the eligibility meeting, they'll let you know, like, yes, your child is eligible for this, but they have to send you home a letter indicating that. And then within 30 days of being found eligible for an IEP, you have to finalize that IEP based on the evaluations. Again, usually what happens is after they have the evaluations done, they have the eligibility meeting to go through all of the documented results of the evaluation, talk about strengths, deficits, areas of need, and then they close the book on the eligibility meeting, open the book up for the IEP meeting. So there are two separate meetings that happen. Usually they happen concurrently. They happen one after the other so that you're able to just sit down and hear all of the report results. And then you move into the IEP where they talk about the goals and how they're going to address the deficits that they found in the evaluation results. And then within 30 days, they have to finalize that. All right, let's go back to our presentation. Ooh. Go through this again. Okay. Domain meeting. So as part of the evaluation process, they have to hold a domain meeting. And basically with this, what happens is they get your consent for providing the evaluation. But within the domain meeting, they actually go through each domain of the IEP and of the evaluation to determine whether or not they need to evaluate the child for that service. So this includes speech, OT, social emotional, health, and vision is included in the health, as well as educational, academic. For each area, that professional will say, yes, I need to evaluate. You as a parent will also discuss their strengths, their deficits, why you think they need to be evaluated in that certain area. The paperwork that you have to fill out to request for an evaluation also has a section for you to describe what areas of need your child needs to be evaluated. So based off of that paperwork, they're going in with some of that information, but during the domain meeting, you can provide more information as to whether or not that person needs to evaluate your child based off of that. It's used to discuss information they already know about the child and determine what areas are going to be assessed. And after the domain meeting, the evaluations will occur. Sometimes with CPS, what they do is they have the domain meeting and then they move directly into the evaluation with your child to start evaluating them. Sometimes school districts, they don't schedule it that way. They have the domain meeting and then, later on in the week, they start to they schedule out the evaluation process. But sometimes you'll see that they do the domain meeting and then they whisk your child away and do the evaluations. After all of the evaluations have been completed, then an IEP meeting will occur. In our experience with citywide assessments, they will do the domain meeting and then complete the evaluations within the same day. If it's a cut and dry, easy IEP, they will sometimes have the IEP meeting on the same day. But generally what they like to do is they do the domain meeting, the evaluations, and then sit down, write up the reports, have a better understanding of what needs to be done, and do an IEP on a separate day. But just to kind of prepare you, if it's a very easy IEP for them to write, your child doesn't need a lot of services, or it's pretty easy for them to identify what they will need, they'll sometimes do the IEP that day. And just a recap from our last meeting in terms of what an IEP meeting is. And this is just to determine if a child is eligible for special education and or related services such as speech, OT, PT, and social work. Again, OT is not a standalone service. It needs to be provided in conjunction with another type of related service on the IEP, but all others, speech, PT, and social work, can be provided without the need for, OT. Those can be standalone. If the child is eligible, then that IEP team will move on and write the IEP. This is also where classroom and school placements are determined, as well as what services they will receive, how many minutes per week they'll receive it, and in what format. Goals will also be written during this time of the IEP meeting, so you'll walk away with a full understanding of what your child will be working on for the next school year within this IEP meeting. From the school side of who will be present at these IEP meetings, you basically will have every service provider that you likely indicated that you needed. So if the joint meeting indicated that we need to assess for speech services, OT services, but not PT or social work, then the only people that will be present are your speech and PT. So if a child has an ASD diagnosis, so autism spectrum disorder, you most likely will have all of your service providers will be present during that. And even if they go through the evaluation process and they indicate like they don't need further services within the school setting because their diagnosis and their disability does not cause adverse reactions for receiving services within the school, they'll still be present to kind of indicate that. But if you just said that your child needs, articulation support, then an OT is probably not going to be present during that period of time for the IEP. If a provider isn't available to the meeting, your case manager and or school district must inform you of this. You need to be notified prior to the meeting because you need to provide consent whether or not you want to move forward with that meeting without that certain provider there. On general cases, they usually provide a substitute. So if your normal speech therapist that your child sees within the school district is not going to be present because they are getting married or whatever reason, they will provide another provider, and that provider will go through the goals and assessment results on that person's behalf. But you have to provide consent as to whether or not you want to move forward with that person being absent. You can always say no, and we're rescheduling. Again, you drive the bus, you have the power to indicate who you want there and who you don't want there. So if somebody is not going to be present and you wish not to move forward with the meeting, you can always reschedule the meeting. In my experience from working at therapeutic schools, if our child's certain speech therapist wasn't going to be present for the IEP meeting because they were going to be out of town or unavailable, they would call the parent and go through the assessment results, the goals, the progress, hear the concerns of the parents, and write something up so that another speech therapist could, relay the report. But that way they're connecting with the parent if they were going to be absent. Again, that parent could say no, I'd like to reschedule so that they could still come to the meeting, but at least that way they're making that connection. I can't always say that that's what's going to happen for CPS schools, but from a provider, that would be the best case scenario is that they call the parent to let them know they're not going to be here and here's what I'm going to state. You also need to have a general education teacher present and a special education teacher or director. Even if your child is not, assigned within a general education setting, they still need to have that general education teacher present at the IEP. And then you'll also be assigned a case manager. And this case manager basically just handles all of the paperwork and is your go-to if you have questions or concerns with regards to the IEP process, your rights, and anything that CPS can offer you. It's going to be assigned based on the needs of the child. So one school could have several different case managers working with different students. Usually at the therapeutic level, you usually have one case manager so that we're familiar with somebody so we can have a nice relationship. But sometimes within the CPS regular school districts, you might have several different case managers working with different kids. It's all based on the needs of the child. The other thing that I wanted to kind of bring to your attention before I go through some of the other paperwork that I'm going to share with you guys is there is a term called multi-tiered system of supports, MTSS. School districts within the state of Illinois and actually throughout the country utilize MTSS to help identify kids who are failing at the regular education level and how to support them. This is a school-wide thing. This is not just even for kids that are receiving special education services, but also kids within the special education services are going to benefit from this multi-tiered support of system of supports. So it's a framework used to ensure that all students have the supports they need to be successful. It allows schools to identify those who might need more support or extra supports, as well as extra modifications to the work that they're receiving and the academic items that they're being taught so that they can be successful within the school system. Students will receive support through interventions, whether it's specific type of instruction or guidance. In theory, this would help us to avoid the wait for them to fail mindset, because we should be able to identify why a student is not doing well and what supports they need to be successful. There are 3 different tiers within the MTSS system. The first tier is all students in all settings. It's just general instruction. So a school really needs to help make sure that their core curriculum is meeting the needs of all their students in all of their settings. You want to make sure that 80% of your students are making success within that tier 1. And if not, then we need to identify what kids are at risk. Those kids who are identified at risk will move into tier 2. So this is where you'll do small group interventions between 2 to 5 students at a time. This is more strategic support, identifying, on a group level or even an individual level, what supports do they need to be successful. Maybe it's only for reading, maybe it's for math, maybe it's for both or all subjects that they're receiving. So it's really targeting different areas for them to be more successful with more specific interventions that are made to be individualized. So, for example, kids that get broken up into centers based on reading level. Not all kids are at the same reading level, so you may group some of your kids at a similar reading level so that they can be successful at that, rather than pushing them into a classroom where everybody's at the same reading level and you have a child that's struggling to make progress at that level. And tier 3 is looking at more smaller groups as well as individual students, and it's more intensive support. So whereas tier 2 could have between 2 to 5 students within that group, your tier 3 is looking at more 1 to 2 students. Again, mostly probably looking at your individual students and how we can help them to succeed within the tier 3. There are 4 essential components of that multi-tier support system. First is the screening. It's generally conducted 3 times a year. It helps identify students who may be at risk for poor outcomes and need additional academic, social, emotional, and behavioral support. So it's not only just looking at your academics, it's also looking at, social, emotional well-being, as well as, behavioral support to help them to be successful within that tier 1. Screening is also used to identify patterns and trends of learning and achievement at the school and the grade levels. The second component is progress monitoring. So you're going to use valid and reliable tools and process to assess performance, quantify that improvement, and then evaluate the effectiveness of that instruction, interventions, and support. This is important because we want to make sure that kids are making progress, and if they're not, then we need to go back to that intervention, make changes again, and then identify progress monitoring, whether or not it's working or not. There's a multi-level prevention system that includes a continuum of tier 1, tier 2, and tier 3 of integrated academic, social, emotional, behavioral, instructional, and intervention supports that are evidence-based and culturally and linguistically responsive. Your kid may start in tier 1 and maybe they move down to tier 2, but once they make improvements, maybe they can move back up to tier 1. So it kind of flows as the child makes improvements in their educational as well as social, emotional, and behavioral outcomes. And the last one is data-based decision-making. We want to make sure that any decision that we're making is based off of the data of the progress and not so much like, I think they're having a great day, or they're making a little progress. We want to make sure that we have something that we can stand by and say, yes, they are making progress. So it includes looking at the data, analyzing it, and problem solving through team meetings to make decisions about that instruction, intervention, implementation, and likewise disability identification in accordance with the state law. So through this process, as I mentioned earlier, teachers can refer out as to whether or not a child needs further evaluation. Sometimes when you're going through these steps and these components, you may be able to identify whether or not a child needs further evaluation for other services based on, how responsive they are to the tier 2 and tier 3 supports. I'm going to take you through each of the tiers to kind of talk about a little bit as to what goes on in the tiers. So the first one is all school, all children. Everybody's receiving the same type of scientific research-based core instruction. And we want to make sure that this is being implemented with integrity. And we're also emphasizing grade level standards and school-wide behavioral expectation. So again, this is everybody. Everybody's within the tier one, regardless if they have disabilities or not. Instruction in tier one should be explicit, differentiated, and include flexible grouping and active student engagement. So even within the tier one, you will be, differentiating that learning style based on how well the child learns. But it doesn't mean that you're going to be implementing more intensive instruction or intervention to help them progress. You want to ensure that 80% of the students' needs are met at tier one through that high quality instruction. And tier one focuses on implementation of the district's core curriculum and is aligned with the Illinois learning standards. If your child is not within that 80% and we're not meeting 80% of those needs, then we need to move into tier two. So tier two is what students receive in addition to tier one instruction. So they'll still receive everything that tier one has to offer, but tier two is to help provide more individualized instruction and supports to improve the student performance under that tier one performance expectations. These are more concentrated, so there's more time, a narrow focus of instruction and intervention than in tier one. They may be pulled out of the classroom to receive more intervention and more support and then push back in. So it's really individualized to what they need to. They can be targeted within small groups of students and can be provided by a variety of professionals. So your general education teacher and or language arts specialist or student support specialist in any setting, whether it's in the general education classroom, separate settings, even at home. They may make some recommendations of things that you need to try at home to help your student. These students have been identified as being at risk academically or behaviorally through those universal screens that are provided within, tier one level. Tier two interventions are implemented with groups of students, demonstrating common skill deficits and or social, emotional, and behavioral risk characteristics. And their targeted group interventions typically involve an additional minutes of instruction. So outside of the core instruction, they'll be pulled out and receiving more specialty services, like for example, the reading one, where they're pulled into smaller groups, but maybe this smaller group is being ran by a reading specialist rather than the general ed teacher. It tends to be more explicit, so more inclusive than core instruction, more supportive in the form of engagement and hand-on experience, as well as more direct with your feedback and positive reinforcement. It's also carefully scaffolded and it occurs in your smaller groups. Tier three is the one that's at the very end and is more targeted. And this is what few students receive and is the most intensive service level a school can provide to a student. Typically, these are provided in very small groups as well as just individual students to help make sure that they're receiving all of the attention and information. It's to help them overcome significant barriers that they may have to their learning, academic, and or behavioral skills required for school success. And it requires more time and more narrow focus of instruction and intervention than tier two services. This requires effective levels of collaboration and coordination amongst several different staff members, providing those services to that student. And the expected outcome of the tier three students is to, combined with the tier one and tier two, is that they will move back up to tier one with more proficient levels. And students who have not progressed with the targeted group interventions at tier two require more time and more intensive interventions. This is because they are individualized, they're more based on your data collected in individual problem solving, and occurs within a smaller teacher to student ratio. It could also happen for longer periods of time, whereas in tier two, someone may be pulled out for a quick brief reading center with a small group that's done with a reading specialist. Maybe that's only happening for 5-10 minutes. Now in tier three, they may be pulled out for 15 up to 30 minutes per day to receive more specialized services with regards to providing them support to get them back up. Only about 5 to 10% of the students will require this level of intensive support, and strategies for maximizing student outcomes during core instruction as well as support at home or in the community will be needed to be a part of this support. Progress monitoring is a huge portion of this, not only with just analyzing the data, but making sure that kids are making progress and that we're catching them as they're going along rather than waiting long periods of time. So the purpose is to determine the effectiveness of the intervention, meeting in your teams to discuss this progress so that we can make those intervention changes quicker rather than waiting. When data shows that they're progressing, interventions are maintained until the student has met those identified goals. And when the data shows that they're not progressing, more changes are needed within the intervention. Doesn't necessarily mean that, if they're not making progress right now, we need to move right into tier 3. Maybe we just need to change up either the frequency or the duration that we're providing that intervention, or maybe that intervention as a whole is not helping them progress and we need to change course and implement a new intervention. When changes are made to those intervention plans based on that data, as well as the team meeting, intervention or phase change lines will be placed into their data so that you can see when the change was made and how that impacts their progress in one way or another. Students receiving tier 2 support should be progress monitored every other week. So we want to make sure that we're staying on top of it and not waiting too long. And then those who are at tier 3 support will have their progress monitored every week. Whereas tier 1, it's done 3 times a year. They're assessing how well the child is doing. Tier 2, monitoring their support and their intervention successes every other week. Then tier 3, moving to every week for that progress monitoring. The full course of implementation of an intervention is anywhere between 6 to 8 weeks. But again, we're monitoring that progress, and if we need to make changes to it, we'll make changes as we go along based off of the data that we're collecting. Okay, before I move to questions, I'm going to show you a couple of graphics to kind of help you understand the process and things like that. And again, I will share all of this information out with you so that you guys have this in your hand to kind of go hand in hand with those slides. So you're thinking about having an IEP. What can you do to set that up? So the first section, we broke it down into 3 separate sections. So the first one is that your child has an IFSP and they're receiving services through early intervention, but they're about to turn 3 and they're aging out of EI. What should I do? So for those who are in step 1 and their child is aging out of early intervention, you're going to reach out to your service coordinator to ensure that there is a transition meeting with the school services and their personnel present so that you guys can talk about what the next steps are for school setting and school services. This should happen when your child turns around 2.5 years old. So again, 9 months before they turn 3, all the way to 90 days before they turn 3. So around 2.5 is usually when this process gets started. And your service coordinator will help set you up with the IEP evaluation with the local school district. Your child is not enrolled in school yet, and I think they could benefit from an IEP. What should I do? So you're going to reach out to the Office of Diverse Learner Supports and Services to set up that initial IEP evaluation. So you'll email odlss@cps.edu. Again, I'm going to share this out with you so that you guys have this, so that you can request an IEP evaluation. Here is, I'm actually going to make this a tad bit bigger for you guys. I'll share this one out with you guys, but this is a brief kind of letter. You don't have to state too much information as to like why you're requesting it or things like that. But I think the more information as to like why you think you need this evaluation would help them to make the decision as to whether or not they're moving forward. So you put today's date, dear Office of Diverse Learners Support and Services. For those of you who may not be in the CPS system, you can look up online to see who the special director or the director of special education services is and put their name. Once your child is within a school district, let's say that you decide to forego, starting the school year with an IEP, you want to do it later, you will put the principal's name or the classroom teacher's name to ensure that your communication is getting across. That's why you're requesting it. So changing the verbiage as to what, who you're requesting it for, whether it's your son, your daughter, giving them the full name, be evaluated for all suspected areas of disability. I understand that I have to give written permission in order for them to evaluate my child. This letter should be considered as a written consent to evaluate my child as required by the IDEA and the state regulations. I've been worried lately that he or she is not doing well in school, and that he or she may need help. He is in, grade level. For those kids who have not entered the school, you can enter in the grade level that they're going to be at the fall, and you can indicate the name of the school, which would be your neighborhood school. Obviously, like we mentioned earlier, not all neighborhood schools have all levels of support, but at this point in time, you're going to request, an IEP and evaluation done for your neighborhood school. I highly suggest that you write a short paragraph or two that describes one or two specific reasons for your concern about your child, whether that's academic concerns, social, emotional, behavioral concerns. Maybe they're here at the academy. You can reach out to us to indicate, what would be some specific reasons that we need evaluation. Talk with your speech OT PT services as well to see what they may have to recommend. There's also an example here as to why you think they should be evaluated. This last one is, I would say, kind of optional. Like, if you don't want to talk to them about like what tests and things like that in the testing process, like if you have a full understanding as to what the next steps are, you can take this part out. But I like to keep it in because it shows that you are interested in the process. You want to learn more. You want to have a collaboration and coordination of care with your child and the school services. So I think it's helpful to indicate, I want to learn more about these tests and what the process will look like and when my child's going to be scheduled for the test. But you should let them know that, I also want to know a date. Within here, you can also state, I have had parents, myself included, indicate, because I know my rights, that they have 14 school days to respond to me. So by putting that part in there, that they have so long to respond to, and you're looking forward to hearing their response, shows that you have an understanding of what your rights are under the law for this process. And then you'll just sign it at the end, and then you'll email it to ODLSS to start that process. The other letter that I'm going to share with you guys is to request an IEP meeting. So part of the evaluation process, you do have if your child is shown to be eligible for special education services, whether that be classroom services or, speech OT, PT, all the goods, you will have that IEP meeting. Well, let's say you're in the middle of the school year and you're just not feeling like some of the stuff is moving forward in the IEP, or you have concerns with thoughts of whether or not they're actually implementing the IEP, or this goal, you and the teacher had a parent-teacher conference, and you feel like this is not the kind of goal that you want to continue working on with your child because of they made a lot of great progress, or they're not making a lot of great progress and we need to make a revision to the IEP. You can request an IEP throughout the school year. You do not have to wait until your 1 year evaluation or your 1 year point in time to do a new IEP. You can request it at any point in time. Again, the school district can say, no, we don't need to have a meeting, but they have to state why that's the case. So this is just a short, reason, just basically requesting that blank schedule an IEP meeting for my child, insert their name. I believe that this district should schedule an IEP meeting for the following reasons, and then indicate why an IEP meeting needs to be called. Look forward to your response within the next 10 days. If you have any questions, feel free to contact me, list your stuff. Please send notice of the IEP meeting date to the following address. They have to mail you an IEP meeting sheet that indicates the date of the conference, the time, the location, who is going to be present, and it needs to be signed off by the case manager. So they have to email that to you or send it through the mail. Generally, it comes through the mail. So this way they can, send you everything, all the correspondence. It's very important to always have written correspondence. So if you talk to the teacher on the phone, or you're having a parent-teacher conference and you guys decide that this needs to happen, I would send an email just documenting your concerns back to the teacher of saying, hey, this is what we discussed on the phone, or this is what we discussed at the parent-teacher conference. these are the plans of action that we're going to do. I'm going to follow up with you after such and such date. Like if you guys are not going to call an IEP meeting to make a revision, maybe the teacher's going to provide more intervention or supports or things of that nature to your child before completely revising a goal, then write an email just to document that. Always document everything because you never know what's going to happen. My hopes and dreams is that you never have to get to the point that you're in a mediation or a due process agreement with CPS or any school district with regards to the services not being provided to your child or your needs aren't getting met for your child. But it's always good to have documentation of everything so you can fall back on that and state on such and such date, I provided this information to you, where are we at with it? It's a scary thing to think about with regards to that, but it is very helpful to have your ducks in a row with regards to documentation. Another thing that I'm going to send to you, and I believe I got this from Equip for Equality, is a parent report form. You know your child the best. That child has been under your care since the day they were born. You have great ideas of what they can and cannot do, as well as how to get them, into great spots or where they need the most help or things like that. So this form is going to help you kind of tailor those responses and put everything into context as to what they need. Be careful about admitting progress to the school because the school only has to provide an IEP that at the time it was written was reasonably calculated to provide meaningful progress. So I'm not stating, that you should shy away from, saying your kid's making great progress. Just be careful of how we're indicating it because we don't want to make it seem as if they're making such great progress that they no longer need this service or support. So use this as a way to gather your responses and your thoughts. You don't need to give this to the school. Give the school only your finished parent report at the end of this document. So think about your child's strengths. What do they like? What helps get them through? And it doesn't even have to be with regards to this, music, writing, sports, and things like that. Maybe their strengths are, using a timer. It helps them to transition well. Your child is really strong at rock climbing and going down the slides. They have a lot of, core movements that they could do, things like that. So what is your kid really good at? And then what areas do they struggle with? Could be academic, could be functional, could be developmental. Think about ways that your child has a hard time with each of the academic sections of reading, math. Maybe it's even just staying focused or even initiating that they need help or initiating the work altogether, following through with demands, things like that. Write down any of your concerns with regards to areas that your child struggles with. And then look at your long-term goals. What do you think, big picture, what would you like to see your child do in the next 5, 10, 15, 20 years? For many of you, your children are only like 3 or 4, or even 5 years old. So even thinking big picture of 5 years, what that could look like. Your kid could be 10, almost to middle school. What does that look like for your child? These are going to change from year to year as to what your long-term goals are. This is just right now. What do you want them to do? And then is your child on any medications or have any medical needs that the school needs to be worried about or concerned about? What do you think your child needs the school to do in order for your child to receive meaningful educational benefit? So again, pulling upon what you know that we're doing at the academy or within their own individual sessions here with their therapist, what is helping them to follow instructions, keep with the routines, things like that, and write that down on that list. This should be like a wish list. This is stuff that they're already using here that's been helpful, and you'd love to see this in the school, just so that you come back with ideas for accommodations and modifications for them. And what things should the school be telling you about on a regular basis? So what is important for you to know about? How do you want this communicated? How do you want this reported? Do you just want a weekly note sent home of how they're doing? Do you want daily communication through a notebook? Things like that. I will stress that many schools do not use like Brightwheel to keep you updated with cute pictures of things that your kid's doing and little, anecdotes and things like that. most schools will sometimes only rely on emails or a communication notebook to go back and forth to communicate between home and school as to what's happening. Sometimes communication can not be so great with teachers in terms of keeping up with, like, he got a scratch today, how did he get that? You might be having to reach out to them. So make sure you make it known as to, you know, how frequent and how much you want communicated to you, what's important for you to know, and what is you know, would be nice to know kind of situation. How should they contact you? What are some best times? And then the student can also provide a report. So this is always nice for students to participate in their IEP process as much as possible. When they turn 13, generally a lot of schools will invite kids to participate in their IEPs. But it's also really nice for kids that are younger than that to identify some things on their own. Like, what do you think you're good at? What do you think are things that are hard to do at school? And ask them some, you know, questions to kind of prompt them through. What do you like to do? What are some things you wish you could be better at? Overall, you know, lifetime goals. What do you want to be when you grow up? Or what are some things that you need to do in order to, you know, achieve that? What can the school do to help you learn? It's really nice through the process of the 504. My daughter's in high school, but through that process, she's been able to identify the accommodations and modifications that she needs to help her be successful within the school. And now she's more apt to advocate and communicate that, as well as learn about the process and teach others about that. So it's pretty cool when kids are able to take that and identify ways as they grow up how the school can help them to be better and to learn better within the school system. And then when is it really hard for you to learn? Identifying if there's any sensory needs, you know, it's too loud, it's too crowded, the room smells queer, whatever the thing is. You have to copy from the board and it's easier for you to see on a sheet of paper. Like, see if they can help identify things that are difficult for them, because those could be easy fixes that the school and the teacher can make. Is there anything that upsets you? When you're upset, what calms you down? And then this is the section that you can present to the people at the IEP. So before is just you getting your thoughts together as to what you need for the parent report. But here through this, you can send this to the school so they can document it. Within the IEP, there is a little section that's called Parent Progress and Parent Concerns, and that is a great place for you to document all of your concerns that you have for your child. It could be related to the school, it could be related to the classroom, it could be related to big picture, behavioral. I got stuff going on with him at home and I need help. It's all about, you know, how best we can help that child. So it's really great if parents are prepared to answer that question. So this whole document kind of helps set the stage for you to be able to have more of an ease at that communication, because again, those IEP meetings can be quite intense in terms of the amount of people looking to you for information about that child. And I sent this last week, but I just want to, there was a section in here that I wanted to pull up to discuss. So the IEP team is basically, you know, composed of not only people who are at the school, but also your own team. You as a parent have the right to bring whoever you want to support you during that IEP process. It could be a grandparent, it could be a caregiver, it could be an advocate, it could be your child's private speech OT. Maybe they have ABA services, could be their BCBA, could be somebody from the academy. You have the right to bring anybody that you would wish to your IEP meeting. You basically just need to tell the school district, hey, I'm bringing these people, so that they can include them not only on the invitation, but also on the sign-in sheet. So the first important person to be at this IEP as part of the team is you as the parents. Again, you know your child the best. You have to be present at the IEP meeting. If you can't make that date or time, please reschedule. You have the power, again, you drive the bus, so to speak, to let them know whether or not you can do that date and time. This is your opportunity to tell the team who your child is, what they do, you know, what they like, what they don't like, you know, what they're like at home, what they're like at other school settings and non-school settings, your vision for them, what is important for you in terms of goals and what they should be working on. Your student has an option to attend any point in time. Again, at 13 usually is when they start to request that the students come in and provide a nice little presentation as to what they've been working on in their own language. But it's up to you. You can bring your child to any IEP meeting so that they can listen in or participate in any way, shape, or form that they can. This brings an opportunity for them, for the child to bring to the team what they enjoy, what they don't like, what they think they're good at, what's hard for them, what they wish the school would do for them. So again, for a lot of our kids, that's going to it's going to create a lot of concern on your end of how do I help them, process that and identify those things. And that is something that we can work on at the academy with you to help them identify that so they can have a voice in their IEP. Special education teacher is supposed to be present as well to talk about what services are going to be provided, what curriculum, where their students' current performance levels and areas of need are based off of those most recent evaluations, make recommendations, as well as the goals. And then again, that general education teacher needs to be present too, so that if they're participating in any general education class, how are they going to participate in that? How are they doing generally within the general education class? Even if the child is just pushing in for some of the specials like art, music, gym, things of that nature, maybe lunch, maybe they're only coming in for 5 minutes of, a math activity. How is the child doing within that time period within the general education classroom? An administrator or a representative of the school is supposed to be there to talk about what school services and resources they have that can be provided to your child, as well as talking about the state and local standards to which your child should be exposed within the school. And then other people that may be at the meeting, anybody who evaluated them or the school psychologist, especially if they were most recently evaluated, could be there to help provide questions and answers to the support services that are recommended. Other service providers, this is really individualized to what your child may be receiving. So you could have your speech OT, social work, or health services there present to give updates. If your child does not receive those services, then that person won't be present. Other people that you may have there that the school may choose to invite are, let's see, for one of my kids, they have the gym teacher come because he goes into gym during the general ed time period, but that gym teacher is specifically there to provide special recreation. So they give a report. Maybe your child receives other health services, such as they go to the nurse to receive medication. That nurse will be present to talk about it. So the school could choose to invite other people, but they must tell you in advance if that person needs to come, especially if that person isn't receiving IEP services from them. The school must tell you that they're present so that you're aware of that. And then at any point in time or during the whole time, you should be taking notes. There will be notes documented within the IEP so that you can review it afterwards to ensure everything is correct. You do not sign anything or should not sign anything at the IEP stating that you agree with it. Take that all home, review it, take some time so that you can better understand it, because there's a lot of information that comes out of it. It's best if you take that home so you can review it and then let them know, yes, I agree to this, or here's where we need some revisions. If you don't agree to something, say so. Tell them, I don't agree with this. And then, like I said, filling out those parent and student IEP preparation sheets will help you to have a plan about what you want to talk about, what's important to you, what you want to share with the IEP team. And if you don't understand something, always speak up, always ask for them to explain and things like that, because they are more than happy to tell you what's happening or explain it even further. And that shows that you're willing to, again, collaborate and coordinate in the care of your students. And then the last and final thing, I know we're coming up on the end of our time, is an IEP transition checklist. This is something that we have developed. We're still in the process of kind of fleshing it out a little bit as to what we expect our parents to be doing as part of the IEP transition. So the first thing is about 9 months out, between 9 months and 6 months, reaching out to ODLSS to set up an IEP. And again, I'll give you that paperwork so you can see, who you contact and things like that. Start gathering the most recent evaluations from your speech, OT, PT, your ABA services, things like that, as to where they're at, so that you can provide that as some background information to CPS. If it's been more than 6 months since they had an evaluation, see if those providers can provide you with a progress report of some sort. And then have your teachers and therapists fill out the general consideration. Usually this is sent by that Department of Learning and Support Services. If they don't send it, request it from them and they'll send it out. And then you can give that to the teachers and therapists so that we can fill it out to best, indicate where the child is, what they struggle with, things of that nature. And then at the 6-month checkpoint, you want to make sure that IEP has been set up, your evaluations have been, in the process of being completed and things like that, and start determining which therapist you would like to invite to your IEP meeting. Again, it's open to whoever you want to. You just need to let them know that to the school, these are the people I'm inviting. And then there's a 3-month checkpoint for us that will just ensure that therapists have created a transition document with your strategies and current goals. If the school placement has occurred, request time so that you can tour it with your kiddo. Therapists will start making a social story about the transition and then ensure the child's school day at CTCA mirrors what will be happening at their new school. So we're kind of still, as you can see, in the process of completing that to share out with each and one of you. And we unfortunately have run out of time. However, you can always email me back with regards to, I have these questions. I'll create a document so I can start answering some of those. I'm waiting for the survey results for more formal so that I can go through that more formally to ensure that we have all of the questions and answers, in there that I can bring to the last and final presentation so I can answer those a little more fully for you. But again, if you have any questions at any point in time, please reach out. We're more than welcome to help meet with you one-on-one to discuss this even further. Our next meeting, we'll be talking all about parent rights, what your rights is as a parent through this whole entire process. Hope you can join me, same time, 12 to 1. And then our final one will actually be on April 3rd because I will be out of town at the end of the month. And we'll be reviewing school placement, special considerations, as well as having a larger question and answer for all of you. That's 1 o'clock. I hope you guys enjoy the rest of your day and have a great rest of your week.